Hello everyone, in this video we will study about the Norma Frontalis. Now Norma Frontalis is roughly oval in shape and it is wider above than the below. Now we will talk about the bones that form the Norma Frontalis. Now the frontal bone forms the forehead of the Norma Frontalis. Then the another bone is the presence of the maxilla that is on the right and left side. Then there is the nasal bones and these bones are two in number. Then the another bone is the zygomatic bone, which forms the prominences of the superolateral surface of the face. Then there is the mandible that we have already discussed in the another video. Discuss about the sutures that forms the norma frontalis. The first suture is the internasal suture that is present between the two nasal bones. Then the second suture is the frontonasal suture that is present between the frontal bone and the nasal bones. Then there is the nasomaxillary suture that is present between the nasal bones and the maxilla. Then there is the lacrimal-maxillary suture that is present between the lacrimal bone and the maxillary bone. And there is the frontomaxillary suture that is present between the frontal bone and the maxillary bone. The intermaxillary suture that is present between the two maxilla, that is the zygomatico-maxillary suture that is present between the maxillary bone and the zygomatic bone. Then the last suture is the zygomatico-frontal suture that is between the frontal bone and the zygomatic bone. We can study the norma frontalis under four headings, that is the frontal region, the orbital openings, the anterior pyriform shaped aperture of the nose, and the lower part of the face. We will talk about the frontal region. Now the first feature of the frontal region is the presence of the superciliary arch. Now it is the rounded and the curved elevation that is present just above the medial part of the each orbit, and it overlies the frontal sinus, and also it is more marked in males than in the females. Then the second feature is the presence of the glabella. Now glabella is the point where both the superciliary arches meet. And then the another feature is the nasion. Now nasion is the meeting point where the frontonasal suture and the internasal suture meets. Then there is the frontal tuber or the eminence. Now it is the elevation that is present above the superciliary arch, and it is more prominent in females than in males. Now we will talk about the orbital openings. The first feature of the orbital openings is the supraorbital margin. Now it is formed by the frontal bone, and at the junction of its lateral 2/3 and its medial 1/3 it represents the supraorbital notch. Now the supraorbital notch or the foramen transmits the supraorbital nerves and the vessels. Now the second feature is the infraorbital margin. Now infraorbital margin is formed by the zygomatic bone laterally and by the maxilla medially. Then there is the presence of the medial orbital margin. Now medial orbital margin is formed by the frontal bone above and by the lacrimal crest of the frontal process of the maxilla below. Now the last feature of it is the lateral orbital margin. Now it is formed mostly by the frontal process of the zygomatic bone, but it is completed above by the zygomatic process of the frontal bone. Now we will talk about the anterior bony aperture of the nose. Now firstly we will talk about its shape. It is pear in shape and it is wider below than the above. Now we will talk about its boundaries. Above, it is formed by the lower border of the nasal bones, and below, it is by the nasal notch of the body of maxilla on each side. Now we will talk about its features. It is the presence of the anterior nasal spine, and it is a sharp projection in the medial plane. Now rhenion is the lowermost point of the internasal suture. Now we will talk about the lower part of the face. The lower part of the face includes the zygomatic bone, the maxilla and the mandible. Firstly, we will talk about the maxilla. Now there is the presence of the nasal notches medially and there is the presence of the anterior nasal spine. Then there is the presence of the infraorbital foramen that is present 1 centimeter below the infraorbital margin and it transmits the infraorbital nerves and the vessels. Then there is the presence of the incisive fossa that is present. Then there is presence of the canine fossa that is present lateral to the canines. Now there are the three processes that we can see in the maxilla. Now the first process is the frontal process of the maxilla. Now it is directed upwards and it articulates anteriorly with the nasal bone and posteriorly with the lacrimal bone and superiorly with the frontal bone. Then the another process is the zygomatic process of the maxilla. Now it is short and it articulates with the zygomatic bone. Then the another process is the alveolar process of the maxilla that bears the sockets for the upper teeth. Now the second bone of the lower face is the zygomatic bone. Now it is the prominence of the cheek and it has the zygomatic foramen. Now this foramen transmits the zygomaticofacial nerve and that nerve is the branch of the maxillary nerve. Now the last thing that is left in Norma Frontalis is its clinical aspect. Now the nasal bone, which are paired in number, is the most commonly fractured bones of the face. And after this, it is the mandible or the parietal eminence that are seen to be fractured. But the most common is the nasal bones.